So the first thing I'm going to do is check the chart. I'm going to put on PPE if indicated. I'm going to wash my hands. I'm going to gather my materials. So what I'll need for this assessment is a pen light and stethoscope. So I'm going to knock on the door. Knock, knock. Hi, my name is Amanda. I'll be your nurse today. I'm going to provide privacy for the patient. I'm going to inform what I'm doing. So I'm going to do a head and neck assessment with you today. So can I identify you, please? Thank you. Can you state your name?
Emily.
Date of birth?
10/26/97.
Okay, thank you. So the first thing I'm going to do is ask some subjective data. So have you had any surgeries to your head or neck?
No.
Okay, don't do that again. Have you had any problems hearing lately?
No.
Any loss of sense of smell?
No.
What about taste? Can you taste things fine?
Yeah.
Have you had any problems swallowing?
No.
Breathing?
No.
Seeing?
No.
Any pain in your eyes, nose, ears, or mouth?
No.
Any pain on your face?
No.
Any pain on your neck?
No.
Okay. Okay. Have you had any surgeries to your mouth?
No.
You have all your wisdom teeth still?
Yes.
Okay. Have you had any sort of surgery
Yes.
to your head
No.
and neck?
No.
Okay. Do you have any family history of problems with hearing loss, sense of smell, like any loss of sensory? Okay. So as I go, I'm going to go further into depth with subjective data. So the first thing I'm going to do with my assessments is I'm going to check the cranial nerves so I can just have ease of mind. So what I'm going to do is go in and feel for that mandibular joint. So I'm going to have you, yep, okay. Any pain or tenderness?
Mm-mm.
Okay, can you open your mouth and close it for me? No, like normal. Okay. Nope, she said she didn't have pain, so no pain noted, no tenderness noted, and no clicking noted. So that's good. So that was 5. I need to remember that because I'll probably forget. So you said you didn't have any loss of sense of smell. So that's cranial nerve number 1. The next thing I'm going to do is go in and I'm going to look at the eyes. I'm going to do constrictive and compensation with the other eye. So I'm going to go in and I'm going to see if it dilates. Okay. I'm going to give her eye a rest. You good?
Mm-hmm.
And then I'm going to go back in and see if the other one dilates. Can you look at me? Okay. And it did. Okay. So I'm going to go to the other side and do the same thing. Can you look at me? Okay. So constricted. I'm going to let her rest for a second. You good?
Mm-hmm.
All right. Look at me again. Okay. I'm looking for that compensation. So that was cranial nerve number 2, and it was intact. Then I'm going to have you look at my 2 fingers and follow my fingers, okay?
Mm-hmm.
Okay. That was cranial nerve number 3, 4, and 6. And I already did number 5 with the jaw. So then 7 is I'm going to have you puff out your cheeks for me. Okay, so cranial number 7 is intact. I can also go in and every single time I touch you say okay for me.
Okay. 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 Okay.
That also makes sure that that cranial nerve number 7 is intact. You said you had no hearing loss, correct?
Mm-hmm.
Okay, so that's cranial nerve number 8. Then I'm going to, can you open your mouth for me and say ah? Okay, so that's cranial nerve number 9, and her uvula went up when I had her say ah. So I'm going to have you open your mouth again, and can you cough for me? Okay. So her uvula her uvula moved for me, and that was cranial nerve number 10. So I'm going to have you shrug your shoulders and push against my hand. Push against my hand. That's cranial nerve number 11. And then I'm going to have you go and that's cranial nerve number 12. So now I'm going to go in and do my complete assessment. I just wanted to get those out of the way. So I'm going to check her head, making sure that it's normal and it's round and cephalic for her head. I'm looking for any lesions, masses, any changes in skin color, so any redness, rashes, irritation, dryness. I'm making sure that her hair distribution is even. I'm looking for any changes in hair color, looking for any gray patches or anything like that, looking for any lice or any sort of that. Also behind the ears I'm checking for that kind of stuff. So that looks good. So I'm going to move to her ears, and I'm noting, I thought I turned that off, I'm noting that both of her ears are normal for her skin ethnicity. The back of her neck skin is normal for her ethnicity as well. There's no rashes or redness noted, any tenderness or anything where I've touched thus far?
Mm-mm.
Okay, I'm going to do a push-pull-push test and tell me if you feel any pain, okay?
Mm-hmm.
Push, pull, push, any pain?
Mm-mm.
Push, pull, push, any pain?
No.
Push, pull, push, any pain?
Mm-mm.
Okay, so I'm going to pull up and out to look into her ear canal. I'm noting that her hair distribution inside her ear is normal and it's even. The serum inside her ear is at a normal consistency. It's not abnormally discharged or anything of that sort. It's normal for a healthy eardrum. Do you have any pain inside the ear?
Mm-mm.
Do you have any abnormal discharge? Okay, I'm gonna do the same thing on this side. So tell me if you have any pain. Push, pull, push.
No.
Push, pull, push.
Mm-mm.
Push, pull, push.
No.
Okay. And I'm going to pull up and out again to look inside her ear canal. Does that hurt?
Mm-mm.
Okay. I'm noting that the hair distribution is even and the serum level inside her ear is normal. So the next thing I'm going to do is look at her head on, and I'm noting that her face is symmetric. I'm taking the outside of her eye and measuring it with the top of her ear to make sure that is even, and it is, so that's normal. I'm making sure that her eyebrows have hair growth evenly. I'm making sure that her eyelashes are growing evenly. There's no patches or redness or irritation or anything of that sort. I'm noting that her skin on her face is normal for her ethnicity. The temperature is normal. I'm using the back of my hands for that. And the moisture I'm feeling with the tip of my fingers. So I'm going to have you look up, and I'm going to pull down. And her conjunctiva is pink and moist, so that's normal. And her sclera is white, so that is normal as well. There's no apices, so we're looking for cataracts there. There's none of that noted. And her eyes overall look well, and they don't look irritated or anything of that sort. So the next thing I'm going to do is go in and observe her nose. So I'm going to have you look up for me. And I'm noting that the hair distribution is evenly distributed on each side, and that there's no lesions or masses. Both nares are even on both sides. There's not any obstructions or anything of that sort. Then I'm going to go in, and before I even do anything, I'm assessing her lips, making sure they're moist and pink and proper for their ethnicity. I'm making sure that there's no scars or lesions or bumps or bruises or anything of that sort. So I'm going to have you open your mouth for me. Okay. Can you say ah for me? Ah. Okay. Thank you. I'm observing her gums and teeth. I'm observing that she still has her wisdom teeth, so I can see those. I'm observing her tongue, underneath her tongue, the hard palate, the soft palate. Can you say ah again? Okay, I'm observing that uvula and the tonsils. I would say the tonsils are a 2+. The uvula has no lesions or masses, neither do the tonsils. And the pharyngeal wall is pink and moist. Everything looked really good in the mouth. So the next thing I'm going to do is I'm going to go in and assess her lymph nodes. So you're really not going to feel anything normally. If you do, that's when you should investigate further. But I'm going to explain as I go where I am. So the first one I'm going to feel is the preauricular. Okay, and then I'm going behind the ear for postauricular. And then I'm going at the base of the skull for occipital. And then I'm feeling right where the sternocleidomastoid muscle is. I'm feeling a little bit above it, and that's the superficial cervical. And then I'm feeling the trapezius muscle where it connects to the clavicle forms a triangle. So I'm feeling right in there for the postcervical. I'm going to do that bilaterally. So I'm going to come to this side as well and do the same thing with the superficial cervical and the postcervical. And then I'm going to have you tilt your head like this towards me. And I'm going to grab that, don't grab too hard so it's not painful for the patient, but I'm going to grab that sternocleidomastoid muscle and I'm going to feel for the deep cervical. And then I'm going to go bilaterally again. So I'm going to have you tilt your head this way. Same thing, grabbing that sternocleidomastoid and feeling for those deep cervicals. So there was no lesions or bumps or bulges, anything like that noted. Did you have any pain during that assessment?
Mm-mm.
Okay. So I'm going to have you look up for me a little bit. And I'm feeling for that thyroid. It was not enlarged, it was not swollen, it was not painful. Was that painful? It was not painful. And there was no like lesions or like anything of that sort in that area. So then I'll make sure the patient is comfortable, wash my hands, put the call light in their reach, and chart my findings.